Hello everyone, this is Mohan Das. Today I am showing you now the elementary first aid set number 1. EFA exit exam questions and answers set number 1. Question 1. What is called the voice box? Answer: larynx. Question number 2. In topographic anatomy, the term lateral means. Answer: away from the midline of the body. Away from the midline of the body. That is the answer. Question number 3. Where does the partly digested food on liquid form go after it leaves the stomach? Answer: the small intestine. Question 4. Urine enters the bladder through which structure? Answer: the ureter. Question 5. Which system is responsible for fight or flight response? Answer: sympathetic nervous system. This is a bit advanced for elementary first aid. Anyway, it should be in medical first aid or medical care topics. So, this fight or flight response is to overcome sudden stress. Okay, it's a stress mitigation. By nature in the body it happens with the sympathetic nervous system. Okay, fight or flight response. Question number 6. What is the correct sequence for the primary survey? So, when somebody is unconscious, so we carry out primary survey. So, there the words used are D or S, A, B, C, D. Doctors A, B, C, D. D for danger, R for response. After that, S is there. S is send for help, doctors. Then A for airway, B for breathing, C for circulation, and the D for to get an AED, connect an AED. So, that is the primary survey, the entire letters D, R, S, A, B, C, D. Here in the choice, the answer was danger, response, airway, breathing. So, you will have to be carefully selecting the choices. So, D or A, B is here. Okay. So, for danger, they may put some other words and all. Be careful. Danger, response, airway, breathing. That is the answer. Question 7. Which of the following are considered cruel protective equipment? A. Gloves, B. Mask, C. Eye shield. Answer: D. All of the above. So, you forget about the cruel and all. Protective equipment with for first aider. Okay. So, first aider, gloves, mask, eye shield, these are all required for a first aider. Okay, so all of the above is the answer. You are taking blood pressure by palpation. A radial pulse indicates a blood pressure of at least, answer, 80 mm Hg. Okay. The palpation method is when there are number of people you will have to attend to, or if the time critical situation, that time you do this palpation. Okay. A radial pulse is taken on the wrist. Okay. So the answer is 80 mm Hg. Question number 9. An unconscious seaman is lying on his back and not breathing. What is the first thing you do? Answer, tilt his head back as far as it will go. So, in the primary survey we saw DRS ABCD, I told you. So, unconscious means we cross the D and R is not responsive. Okay. So, what is the first thing you do? A, airway. To clear the airway, tilt his head back as far as it will go. So, you must have learned that to keep one hand on the forehead, 2 fingers on the chin, and put the head back as far as it will go, so that your airway is cleared. Then you check up for breathing. Okay, the answer is tilt his head back as far as it will go. Question number 10. If you suspect a head or neck injury, answer, support the head and neck in the position found. So, you should not move him much. Okay, without moving, support the head and neck in the same position. Question 11. When a victim is having neck injury, answer, hold his head. Okay, hold his head. Question 12. You suspect a head and neck injury in a victim who is unresponsive and not breathing. How would you open the airway to give breaths? So, answer is jaw thrust technique. So, here you suspect a head and neck injury or even spinal cord injury also. The normal clearing of airway technique, which I just now explained for the other question, keeping one hand on the forehead, 2 fingers on the chin, lift the head as far as back, that is not the correct way to clear the airway. So, what we do is we keep one hand and take the head backwards, but instead of using your 2 fingers to lift the chin, bring the jaw downwards. So, that is called jaw thrust technique. That is done for suspected head injury, neck injury and spinal cord injury. Okay, jaw thrust technique. Bring the jaw down. Then also you can open the airway. Question 13. Check the carotid artery for a pulse on, answer, side of his neck. So, carotid artery is on the neck. So, on the side of his neck you will have to check. Question 14. Fainting happens when, answer, brain did not get enough blood. That means enough blood with oxygen. So that is momentarily, for a fraction of a second. You must have seen the children standing in the school prayer in the hot sun, they fall, they faint and fall. So the moment they fell on the ground, they will be okay. Same thing will happen in the defense forces also, doing parades and all in the hot sun, standing there listening for the instructions. People will fall. That is fainting. That fainting is momentary. The moment they fell, they are okay. Okay, so the answer is brain did not get enough blood with oxygen. Question 15. If there is no response from the crew, okay, when you are doing the primary survey, if there is no response, call 108 and return to the crew if the crew is an adult. Then carry out your DRS ABCD with CPR and all that. Okay, the choice here, answer, call 108 and return to the crew if the crew is an adult. So unresponsive victim, what we do? CPR. Question 16. Shock is a condition where, answer, the cardiovascular system fails to deliver to all parts of the body. That means your heart is not pumping blood mainly to the organs, to the brain, to the heart itself, other organs and the entire body. So the brain, if it is not getting oxygen, it will not function. So it is a time critical situation, shock. So shock can happen on various occasions, mainly your severe bleeding, severe vomiting, severe diarrhea, all that. There are many conditions where shock can happen. But what is the first aid for shock? First aid for shock is simple 3-step only. Raise the legs about 10 to 12 inches, cover the body and reassure the patient. That is all the first aid for shock. So even with severe injury cases or severe burn injury, a lot of area is burnt where your plasma is coming out, that time also you can expect. So you do not allow the victim to go into shock. Okay, before, what are all the causes for shock you should know, then you start giving the first aid also. So as you are treating for severe bleeding or severe burn injury, you do the first aid for shock also. It's very simple. So answer here is the cardiovascular system fails to deliver to all parts of the body. Okay. Question number 17. What is the CPR procedure for a 6-year-old boy? So 6-year-old means child. Okay. Answer is 15:2, 4 cycles in 1 minute. That is the answer. There are a number of other questions with this 30:2, 15:2, 5:1 and all that, right? So if you refer the International Medical Guide for ships, which you can freely download on the internet, okay, I have done so. There in the third edition, which is there in the internet right now, page number 27, if you see, if there is a single rescuer, he can do 15:2. Okay, for adults, I am talking about adults. If there are 2 rescuers, he can do 5:1. Okay, so 15:2 for a single rescuer for adults, 5:1, 2 rescuers for adults. 30:2 is internationally all the first aid instruction they are giving. So, all these are correct answer. So, in this place, what is the CPR procedure for a 6-year-old boy? Answer is, the choice was 15:2, 4 cycles in 1 minute. Okay. Question 18. What is the proper rate of chest compressions in CPR? Answer, 100 per minute. So, many videos and books will state 100 to 120 per minute. That is the correct thing. And here the choice was 100 per minute, which you will have to select. Question number 19. If an AED is available but does not have child pads or child energy setting, what should you do for a 6-year-old non-responsive victim? Answer is, use the AED and adult pad. Okay. Earlier days we had only one AED. Nowadays you have the pediatric AED for children also. So, what will be the difference? The difference will be in delivering the shock voltage. Okay, that is why energy setting they say, right. So, if you see St. John's ambulance video, they recommend above 1 year you can make use of the AED to anybody above 1 year age, 1 year old. Okay. Since pediatric AED has come to market, less amount of voltage may be delivered to the children. So, they have the pediatric one. So, this question is relevant to that. So, there we can use the AED with adult pad. That is the answer. Question number 20. When giving care for external bleeding, what should you do first? Answer, apply direct pressure. So, bleeding first aid, number 1 is applying direct pressure. Number 2 is elevating the limbs. If the injury is on the limbs, the hands or legs, you can elevate them. Number 3, apply indirect pressure. And the last resort, in case of amputation, very severe arterial bleeding, which cannot be controlled with these 3 systems, direct pressure, elevation, indirect pressure, then as a last resort only you go into tourniquet. Okay. In this question, when giving care for external bleeding, what should you do first? Apply direct pressure. So, always apply direct pressure. For how long? 10 minutes. Question number 21. For heavy bleeding, you need to apply pressure point to reduce bleeding. So, we have in the body 22 blood pressure points, 11 on the right side, 11 on the left side. So, uncontrollable bleeding with the direct pressure and elevation, you can go, the next step is using the pressure point where you can apply the pressure. Okay. So, answer is yes. Question number 22. You feel a sudden sharp pain in the bottom of your left foot. You look at the bottom of your left shoe and see a tack sticking in your shoe. What type of wound do you probably have? Answer, puncture wound. There are different types of wounds, and this type of tack sticking will make puncture only. So, it is called puncture wound. Question number 23. Tourniquet can be used for first resort to stop bleeding. I told you just now, tourniquet only as a last resort. Normally they are used in case of amputations, finger, hand, leg. It is used only in the limbs, nowhere else. Hands and legs only you can use. Okay, tourniquet can be used for first resort to stop bleeding. Answer, no, it's a last resort. Question number 24. Tourniquet can be removed as and when necessary. Answer, no, it should be removed by doctor. Because to stop the very severe bleeding, you apply tourniquet, and there is a rule, when you apply the tourniquet you must write the time also, what time you applied the tourniquet. Okay, it can be removed only in the operation theatre by a doctor. So answer is no, it should be removed by doctor. Question number 25. What are splint made of? Answer, clean plastic. So these are ready-made splint. Splints are used for supporting your fracture. Okay. So when you have a long bone fractures, you use splint. We can improvise with anything, but the ready-made one which is in the first aid box or in the hospital, so they have these clean plastic ones. Okay, we can use anything. We can use even a bundle of paper, bundle of magazines. We can use a wooden stick. We can use a long thin rod. Anything you can use. You can improvise, but the ready-made one is clean plastic. That is the answer. Question number 26. What should you do if you think a crew has internal bleeding? Answer, call your local emergency phone number for help. As a first aider, you are helpless to do any first aid for internal bleeding. First of all, internal bleeding symptoms will appear after much delay. If you had seen some heavy object fell on the victim, or if he claims, if the victim says that some article fell on him, on the chest or behind or wherever, okay, so that area you will find like a dark color bruises. That symptom will come after few hours maybe. So as a first aider, you are helpless. You can only get a medical advice from the ship and try to take him to the hospital. So answer here is, call your local emergency phone number for help, medical advice. Question number 27. Burns that involve all layers of the skin are? Answer, full thickness. So here in the choice it was full thickness. Normally we discuss first degree, second degree, third degree, 3 layers of the skin, 3 degrees. Okay. So all layers means all the 3 layers. So that is called full thickness. Question number 28. For second degree burns can break the blister. Answer, no. See, by nature the blister is formed when the second layer of the skin is affected by burn injury, the blister will appear. The blister is the symptom for second degree burn. By nature, to protect the skin only it is forming. That you should not break. So answer is no. Remember, first degree burn symptom is redness. Second degree burns symptom is blister. Third degree burns symptom is charring, black color, white color. So first, second, third degrees. Okay. Question number 29. On second degree burn, if 15% of the body is affected, take the victim to hospital. Answer, yes. See, in the burn injury, the first degree, second degree, third degree, they are okay. They are less problematic, you can treat them well. But the body surface area, BSA, if a larger area is burnt, then the problem comes. Okay, then the victim will go into shock and death, because when the large area is covered, lot of fluid will come out. The victim will naturally go into shock. The next step to shock is death. So you will have to be hospitalized immediately. Okay, here they say 15%. The body surface area is reported by rule of nines. Okay, so you check up in the internet rule of nines. So they have 9%, 9%, 9%, 9%. Totally, if you add up, it will come to 100%, because the groin is 1%. Okay, so it is called rule of nines. So here 15% of the body is affected, means you will have to take him to the hospital. Question 30. First aid for the frostbitten are: A. Give some hot coffee. B. Give some hot tea. C. Give some alcohol. Answer, D. Nothing above. Frostbite is also a burn injury. It's a cold burn injury. Okay. The first aid for frostbite is dip the part in the warm water. So that is the treatment for frostbite. So what is given here? Nothing should be given. No hot coffee, no tea, no alcohol. So nothing above. Question number 31. Which of the following increases the risk of hypothermia? A. Old age. B. Very young age. C. Use of alcohol. D. All of the above. Answer is all of the above. Hypothermia. Okay, that is the condition affected by the cold. When you are in the water or in the cold climate, your body temperature dissipates very fast, then that condition is hypothermia. Okay, that can happen in old age, very young age, use of alcohol also. So answer is all of the above. Question 32. Drowning treatment requires. Answer, doctor's advice. You must have given some first aid and saved him, but anyway, you must take a medical advice. Drowning treatment requires. Answer, doctor's advice. Question number 33. Irrigate eyes with answer, saline solution. Okay, saline solution. Question 34. Can you use neutralizing agent for cleaning eyes? Answer, yes. Okay, yes. Question number 35. Which of the following should be done for a person experiencing a heat related illness? Answer: apply cool wet cloths. Okay. Question number 36. Sign of heat exhaustion are: A. Fatigue, B. Weak pulse, C. Collapse. D. All the above. Answer: D. All the above. Heat exhaustion. Question 37. Cool the heat stroke person until its temperature comes to. Answer: 98 degree Fahrenheit, 98 F. Okay. Another question, there was a choice of 100 degree F. That is the next question I put up here. Same question. Question 38. Cool the heat stroke person until his temperature comes to. Here that 98 F was not there, 100 F was there. So you see the question. If 98 is there, that is also correct. 100 F is there, that is also correct. If both are there, 98 F is correct. Question number 39. Which of the following is a sign of severe airway obstruction? A. Forceful cough, B. Wheezing, C. High pitch inhalation noise, D. All of the above. Answer: all of the above. This is the symptom of a choking person, choking. Okay. So the first aid for choking, all of you know Heimlich maneuver. Okay, that is abdominal thrust. So here are the symptoms. Which of the following is a sign of severe airway obstruction? Forceful cough, wheezing, high pitch inhalation noise. So all of the above is the answer. Then you may find some questions where you will have to, the answer should be encourage forceful cough for a choking victim. Encourage forceful cough. Okay. Question number 40. Ice packs on sprain helps. Answer: reduce the swelling. It is not for reducing the pain, it is reducing the swelling. Question number 41. A victim has consumed petroleum product or acid and the person is not consulting. Answer: give him glass of water or milk. Petroleum product. There's a mistake in this. It should be 42. I will correct it. Okay. Question number 42. Toxic substances can affect the body in following ways. Toxic means poison. Yeah, through the lungs, through the skin, through the eye. D is all of the above. Answer: D, all of the above. Toxic. Question 43. Electric shock victim to be seen by doctor. Answer, yes. You may give first aid, but you will have to be sent to see the doctor. Question 44. Amoebiasis meaning. These are all medical first aid, medical care question. Answer, infection with amoebas, especially as causing dysentery. Okay. Amoebiasis. Question 45. Angiostrongyliasis meaning. Answer, anginostrongylus is a parasitic nematode, can cause severe gastrointestinal or central nervous system in humans. This is an answer. These are all bit advanced question for elementary first aid. Anyway, they ask this question, you answer this. Question 46. Bacteria multiply rapidly between. Answer, -4 to -60 degrees centigrade. That is the answer. Question 47. Cooking food normally. Answer, 60 degree centigrade. Question 48. Tetanus is a condition. Answer, that can be prevented by immunization. So, we take TT injection, that is the tetanus. Question 49. Confined space can be entered. Answer, after confirming oxygen level with 2 instruments. After confirming oxygen level with 2 instruments. Question 50. Asphyxia occurs when a person cannot get enough. Answer, oxygen. So, in this first set I have uploaded 50 questions. The second set I will try to upload 50 more questions. Okay, read them again and again, and you can easily pass. So, you should give feedback. My WhatsApp number is here. Okay, 8825865140. Any questions which is not covered in my sets, set number 1 or 2, that you can put it in the feedback. Or how many questions out of these videos came, that way also you can send a WhatsApp message. Okay, the next slide I am showing you the book what I have published. This is the book for BSc Nautical Science Students Handbook, GMTSS. Okay, e-book now available in Amazon Kindle store. Thank you and bye until the set number 2.